Hola, buenos días, buenas tardes a
Good
todos.
morning, good afternoon to all of you. Welcome to the first press briefing of 2022 here at the Pan American Health Organization, PAHO, on the COVID-19 pandemic in the Americas. My name is Luciana Villegas. I am advisor on public affairs with PAHO, and today is Wednesday, January 12th, 2022. As usual, we have interpretation into English, Portuguese, French, and Spanish, and you can choose the interpretation button at the bottom of the screen. You can also ask questions during the session using the Q&A button, and also we have received some of your questions via email, and we will be starting with those. Please remember that journalists need to indicate their name and media outlet when asking the question. Dr. Carissa Etienne, PAHO's director, will be updating you today on the situation of COVID-19 and also the spread of Omicron in the Americas. Together with Dr. Etienne, we have Dr. Jarvas Barbosa, Assistant Director of PAHO, Dr. Sylvain Adgueri, Director of Health Emergencies, Dr. Sylvain Adgueri, Incident Manager, and Ciro Ugarte, who is the Director of Health Emergencies. And now I give the floor to Dr. Etienne.
And good morning. Let me wish each of you a happy new year. And thank you for joining our first press briefing of 2022. Since the start of this pandemic, nearly 300 million people around the world have been infected with COVID-19. And the virus has quickly picked up pace over the holiday season, reaching levels of transmission never seen before during this pandemic. Over the past week, COVID infections have nearly doubled in the region of the Americas, rising from 3.4 million on January 1st to 6.1 million on January 8th. To compare with last year, during the week ending January 8, 2021, the Americas had reported a total of 2.4 million cases, while this year, by the same date, there were 6 million reported cases, representing a 250% increase year to year. Infections are accelerating across every corner of the Americas. And once again, our health systems are being challenged as emergency room visits and hospitalizations are rising. Nonetheless, thanks to the protective power of vaccines, in fact, COVID deaths are not rising with the current wave of infections. The United States is reporting the bulk of new cases, where its eastern and midwestern states are experiencing a rapid surge. In Canada, cases are also picking up speed in its eastern provinces. In the Caribbean, Puerto Rico and the Dominican Republic are reporting the highest numbers of new infections. Although other islands like Jamaica, Aruba, Curacao, and Martinique are also seeing significant jumps in COVID cases. Meanwhile, Belize and Panama are reporting the highest incidence of COVID in Central America. Further south, Bolivia, Ecuador, Peru, and Brazil are experiencing significant increases in new cases. COVID hospitalizations are also up throughout Brazil, particularly in densely populated states around the central and eastern parts of the country. In Argentina and Paraguay, COVID infections have increased by nearly 300% over the last week. Today, of course, all eyes are on Omicron, which has reached nearly every country in the world. 42 countries and territories in all subregions of the Americas, North America, Central America, South America, and the Caribbean have already detected the Omicron variant. Since countries are already experiencing widespread community transmission, as Omicron spreads more quickly than other detected variants, and more likely via airborne transmission in closed spaces. And while Delta is still causing new infections in the Americas, based on current trends, Omicron is on track to become the dominant strain in our region. It also has led to a rise in reinfections, even among those who are fully vaccinated. This new wave of infections, it won't be mild for our health systems, as the Omicron variant is already challenging our health workforce and limiting care for other diseases. In smaller island states, some hospitals were already strained by cases of the Delta variant, and now more hospitals face the prospect of being overwhelmed with cases. One of the characteristics that sets Omicron apart seems to be less severe symptoms. But even so, Omicron infections can be lethal, especially for the immunocompromised and the unvaccinated. So the time to act is now, using the many tools that we now have at hand. Prioritizing symptomatic individuals for testing and making rational use of these resources is critical to catch infections quickly and early. Maintaining and reinforcing the public health measures is paramount to slow transmission. The PCR and rapid antigen tests recommended by PAHO remain effective at detecting the Omicron variant. So countries should continue to use existing protocols with rational use of tests. PAHO's strategic fund makes COVID tests available at low prices, so countries should take advantage of this resource. Vaccines are especially important as Omicron takes hold. Countries in the Americas have been working diligently to secure the vaccines that they need to protect their population. And thanks to their efforts, nearly 60% of people in Latin America and the Caribbean have been fully vaccinated with 2 doses. And many countries in our region, like Chile, Cuba, and Argentina, have some of the highest vaccination coverage rates in the world. Vaccines are helping to save lives, and expanding equitable coverage everywhere remains our priority. WHO's expert group, the SAGE, has also called for vaccination strategies optimized for prevention of severe disease, including the targeted use of booster vaccination. This applies to people at high risk of complications and healthcare workers who are more exposed to the virus. We must continue to protect our health workers. Our region's ability to respond and overcome this pandemic depends on men and women who staff our primary healthcare centers, clinics, and hospitals. As health professionals everywhere handle the influx of new cases requiring immediate care, we must make sure that they are protected from the worst consequences of this virus. Wherever enough vaccines are available, health workers should be prioritized for an additional COVID vaccine dose. Additional doses are safe and effective and will help reinforce health workers' ability to withstand exposure to the virus, especially now that infections are rising. 39 countries and territories in the Americas have been rolling out additional doses to ensure their populations, including health workers, remain protected. But protecting our health workers cannot stop there. We urge countries to ensure that they have the right protective equipment so our health workers can do their job safely. With a virus as transmissible as this one, effective and well-fitted masks help us all stay safe. So we urge countries to provide their health workers with the PAHO WHO recommended protective equipment, including masks with the highest filtration capacity. While COVID continues to spread in our region, we remind everyone that our goal has always been to protect each other from the most serious symptoms so we can save lives and prevent deaths from COVID infections. And saving lives remains our highest priority. Once again, we must slow down new infections to avoid overwhelming our health systems. Governments must act guided by evidence to limit new infections. And we all have a personal responsibility to keep each other safe by following proven public health measures like mask wearing, social distancing, and avoiding large gatherings, by getting vaccinated when it's our turn, and by getting tested if we suspect that we are sick. Our collective actions against this virus have the power to change its course. Whether we are fighting for vaccine equity, supporting our health workers, or doing our part to reduce the risk of transmission, solidarity will pave our way out of the pandemic. Thanks for listening.
Thank you very much, Dr. Tien. We start with a general question that we received from a couple of media. As we enter 2022 and the third year of the pandemic, what are PAHO's priorities for the year? Dr. Tien?
Well, let me thank you for this question. For 2022, our priorities are to protect the gains that we have made against COVID-19 in the last 2 years by helping the countries develop their surge capacities to treat patients and helping them continue to roll out vaccination campaigns. Both of these have proven to help reduce mortality in the region. And our challenge now, I think, is to deal with the rapidly evolving situation of COVID-19. We must also, I believe, advocate for maintaining the discipline of the important public health and social measures that have helped limit transmission. The key public health measures we continue to recommend include the use of well-fitting masks, physical distancing, ventilation of indoor spaces, avoidance of crowded spaces, especially during parties or celebrations, and also hand hygiene. This will help reduce transmission of SARS-CoV-2, including its Omicron variant. Because the emergence of new variants is a key factor, we also have to strengthen our virus surveillance systems in the region and to give them the tools to rapidly report any new data to our regional and global systems, such as GISAID or GSAID. Another challenge is to prepare our primary healthcare systems to handle and fairly distribute any new therapeutic or treatments that may become available in our countries. And of course, it is important to continue and to intensify our successful vaccination programs to reach at least 70% and hopefully much more than that of our eligible populations with rational implementation of immunization protocols, including the additional doses or boosters to protect people at high risk and to protect our health workers. This would require, of necessity, our working with member states to address vaccine hesitancy, which is very present, particularly in the Caribbean islands. Thanks.
Thank you, Dr. Tien. Pasamos a las próximas preguntas. Empezamos con...
We now move on to the next question. We have a question on Omicron. We have a question from Turk and Caicos.
How does PAHO describe the rate of breakthrough infections due, it appears, to Omicron? And what percentages of cases are Omicron or Delta? And if PAHO is offering any support in terms of testing kits and materials to countries. Dr. Altigeri.
Yes, thank you from this series of questions from the Bahamas. I'd like to mention that thanks to the active participation of most of the national laboratories, public health laboratories in the region, in the PAHO Genomic Surveillance Network, and the sustained efforts of the countries to generate timely data, we have been able to follow the distribution and circulation of different variants, including those of concerns and including the Omicron variant. So, although the Delta variant is still predominating in the Americas, and as Dr. Etienne said in her remarks, as of today, Omicron has been detected in 42 countries and territories. Omicron is probably going to become predominant during the next weeks. Regarding the support of PAHO, PAHO has provided testing kits and materials since the beginning of the outbreak, very early 2020, starting February 2020. And PAHO has continually maintained the support to all member states to ensure the detection and the timely diagnostic of COVID-19. Just to provide you with some figures, as of today, in addition of the PAHO strategic funds, PAHO has donated reagents for more than 12 million PCR tests and more than 3 million antigen rapid detection tests. In addition, sequencing materials for the genomic surveillance and molecular screening to detect the variant of concerns has been delivered to more than 22 countries. Another part of the questions. For different reasons, it's difficult to accurately describe and follow the COVID-19 breakthrough. Although individuals already vaccinated can get infected, they are usually asymptomatic or they develop mild disease, preventing them to seek medical attentions and getting tested. Even if a virus is detected, not all cases will be sequenced. So confirming variant in the affected population might be challenging. Evidence shows that breakthrough may occur with Omicron in higher frequency. Nevertheless, it is important to remember that other variants of concerns, including, of course, the highly transmissible Delta, can also infect vaccinated people. Therefore, as we have explained in many other press conferences and technical documents and communications and press release, maintaining public health measures, including social distancing and proper use of masks, in addition to vaccination, is critical to slow down the transmission. I hope I have answered the concerns from the journalist in the Bahamas. Thank you.
Thank you, Dr. Aldigueri. Pasamos a una pregunta de Estefania Escobar.
We move on to a question by Stefania Escobar, who is a reporter with Diario Reforma in Mexico. She has a comment on the implementation of the health passports in some countries, in particular in connection with the discrimination that this could result in, for example, excluding individuals that cannot travel because of some pharmaceuticals that are not allowed in the United States or in Europe. Thank you very much for the question. This is Dr. Barbosa. We now have about 60% of the population that has already been vaccinated in Latin America, but there is great inequality. We have some countries that are the ones that vaccinate the most in the country. We have Chile, Cuba, Canada, Uruguay, and Argentina that have vaccinated more than 75% of the population, but we still have 10 countries that have been unable to vaccinate 40% of the population that was the target by December 2021. Health passports, and some have already mentioned that we already need an agreement among the countries for PAHO and WHO to discuss this recommendation or to make that recommendation. The agreement that the countries have nowadays as to the vaccine that may be mandatory is the yellow fever vaccine, and we understand because it is why it is difficult to reach consensus, because many countries in the world have no access to vaccines in a broader fashion. So to make a representation on passports for vaccination and also the mandatory nature of vaccination may be a factor to increase inequality and difficulty in access for the countries. This is a difficult decision to make, and the countries also need to remember that this is not an isolated measure, the one that could lead to protection, because first, the vaccinated individuals may also be the source of transmission for COVID in a more mitigated fashion, but they do continue with transmission. So we need to have broader measures to reduce, in fact, the risk of introducing new variants in a country, and also to see what responses are being offered to each of the countries. So I think that this indeed is very important. And PAHO has always stated that all of the vaccine producers may present their application to be approved for emergency use by WHO. The process is also to be implemented by all of the producers who are interested in having their data validated, and this would be an important measure to have more vaccines through the revolving fund that PAHO has, and also to have more vaccines that are recognized by a higher number of countries in the world. Thank you. Thank you, Dr. Barbosa. We now move on to a question from Venezuela. Kevin Arteaga Gonzalez from El Carabubeño has two questions. The first one is, what is the level of progress made by Omicron in the countries? Is it the prevalent one? And also whether there is a general snapshot of the pandemic in Venezuela. And the second question is, how has vaccination been implemented in the country after the COVAX deliveries to the country? Dr. Ugarte, maybe you can address the snapshot of the situation with Omicron, and Dr. Barbosa could refer to vaccination. Thank you. This is Dr. Ugarte. Thank you, Luciana. Thank you, Kevin. From the very first report about the detection of the Omicron variant in Venezuela in December last year, we estimated that this variant will progressively reach other areas of Venezuela, as we have seen in most countries, and also increasingly this will become the prevalent variant. However, as our director has already mentioned, as well as Jarbas and Sylvain, the issue here is the opportunity we give the virus to be transmitted from one individual to the next. And as we implement the measures to reduce that risk of transmission among individuals, we will also be reducing the probability for Omicron, that is a highly transmissible variant, to have a higher impact in a shorter period of time on health services and the population. At this point in time, many countries in the Americas have reported significant increases of new cases and
y ocupación de camas de cuidados intensivos.
in the number of hospitalizations and also beds in ICUs. For example, Venezuela over the last week reported an increase by 89% of new cases. If we compare to other variants and also to other countries, we could say that this was a significant increase, or an important proportion of this increase may be due to Omicron, but this has to be confirmed. Anyways, regardless of the variant, this is a problem of public health that we need to take into account, and also from the point of view of deaths. Over the last week, we have seen a 37% increase. With this, it does not mean that the health services are overwhelmed, but the protection measures will make a difference. So we need to underscore this process for Venezuela and other countries in the region. Over to Jarbas. Thank you, Ciro. In Venezuela has already received 5,470,000 vaccine doses through COVAX. Venezuela started to participate in this mechanism, and from that moment on, we have had different conversations with the Ministry of Health of Venezuela and other actors for all of the vaccines that have been allocated to Venezuela may be delivered as soon as possible. With those vaccines, almost 5.5 million doses, and also by means of the bilateral agreements, Venezuela is reporting that they have already vaccinated about 40% of their population. That is to say, this is an important achievement. 40% is an important achievement, but a lot has to be done. You need to remember that the goal, the objective is to have at least 70% of the population vaccinated up to June this year, or by June this year, and with the new Omicron variant, to have greater access to vaccines and also to deploy vaccination campaigns, which become even more important.
Thank you, Dr. Barbosa and Dr. Ugarte. Now, from Matias Luvi from Argentina, he asks, do you think it's reasonable or logical to shorten or eliminate the days of isolation from close vaccinated contacts as it's being proposed in Europe and in other parts of the region, like in Argentina? Dr. Aldigueri, thank you for your question from Argentina. But first of all, let me clarify that the term isolation applies to confinement of cases of COVID-19, while for confinement of the contacts of those cases, we use the term quarantine. So I understand that the question refers to quarantine, therefore. So since June 2021, according to the technical guidelines of WHO regarding quarantine, contexts and situations have been envisaged where it would be warranted to consider adjustments to the period of contact quarantine in terms of shortening its duration below 14 days. It is important, as we have emphasized before in another question, it's important to mention that both personal protection measures, such as physical and social distancing, continue to be essential for any strategy to respond to the pandemic, and therefore to wonder about adjusting the quarantine period implies that you're going to use an approach based on risk for making the decisions. And for this, you need to weigh risks and benefits for public health and for health services vis-a-vis social risks as well as economic risks. I would like to emphasize here and that in a very challenging current situation, which is characterized by the fast spread of the Omicron variant and its impact on the capacity to maintain essential infrastructures working, including labor shortages related to maintaining quarantine. And therefore, in this context, we should be looking for options, and this is warranted, to adapt the national response approaches in terms of the quarantine periods, making decisions based on several factors, based on what is considered acceptable by the communities, and based also on the available resources in terms of testing capacity, and having different approaches for people who are vaccinated, meaning people who have a lower likelihood of needing hospital care, even though they may become infected, and those non-vaccinated individuals who could run the risk of overloading the healthcare services in case they are infected, and also based on the risk that is considered acceptable by national authorities. So I hope I have answered your question. Thank you. Thank you, Dr. Aldigueri. It's a question in English.
From a reporter, Jasmine Brown from the Bahamas, our news broadcast reporter, but also from other journalists. We are receiving a lot of questions, journalists. So I'm sorry, we have to condense, sometimes combine them into other ones. So BBC Mundo also asked this question related to this about increasing restrictions. Jasmine asks, yesterday, the government in the Bahamas indicated that is looking at increasing restrictions. What is PAHO's recommendations for small countries like the Bahamas, especially seeing huge spike in cases due to the Omicron variant? And she asks a second question. The CDC has warned against cruise ship travel, even for the vaccinated, for countries like the Bahamas that rely heavily on tourism. What is that is a problem, of course. What is PAHO's view on cruise ship travel, or travel in general? Perhaps we can broaden that, given the global surge of the Omicron variant. Dr. Ugarte, perhaps you want to take a stab at that question?
So much. This is highly relevant, as you said, for many countries, and particularly in the times of Omicron. Regarding the Bahamas, the samples have been sent for genomic sequencing, and the official response is on its way to the country. But according with the epidemiologic situation, but also that has been highlighted also by the Minister of Health of the Bahamas and PAHO, it is highly probable that the samples will turn out positive to Omicron. So it is highly important also to recognize that the spike of new cases in many countries, including the countries in the Caribbean, and because of the situation of the health services that were already overwhelmed, and the situation of the healthcare workers, and the probability of dramatically increase in the transmission, this type of measures have to be taken into consideration with an cautious approach. So PAHO has been always urged utmost caution, and even considering resuming cruise ship traffic, because of the very specific and still poorly understood dynamic of the spread of the virus on board cruise ships, for example. So in regarding to national authorities, our recommendation has been to proceed in a progressive manner, and on the basis of clear operational and administrative agreements that they have with the tourism industry. And therefore, in the context of intense transmission due to the Omicron variant, as we have highlighted several times, it seems just logic, judicious, that suspending or at least limiting the cruise ship traffic as an outbreak on board might end up exceedingly high, and probably will go beyond the capacity of the local health services. It is a very cautious approach. We need to balance, of course, what is the economy, what is the well-being of the population. At the same time, we have to continue saving lives and reducing the impact in all sectors. Thank you.
Thank you, Dr. Ugarte. Pasamos a una pregunta sobre el virus Omicron desde México. Blanca Valadez.
A question from Blanca Valadez from Milenio in Mexico. What lethality is Omicron's? Is it similar to the flu? And the other question is, so what about the combination of variants, Delta and Omicron? Dr. Aldigueri, please. Yes, thank you. I think we have three questions here, and they are slightly different. So let me give you my answers in groups too. Evidence so far shows that Omicron has up to threefold higher transmissibility than Delta, that up to now until December, Delta was the one which had the highest transmissibility capacity. However, it seems that Omicron doesn't have a better intrinsic ability to transmit. And so what it does is that Omicron evades the immune response and it generates infection even in vaccinated patients or in patients who were briefly infected. Likewise, the data obtained so far in various parts of the world, including the Americas, indicate that Omicron does not generate a more serious disease or more lethal disease, and hospitalizations and deaths by Omicron in patients with full vaccination schedule are minimum. So we're not regarding Omicron as a simple flu. It is important to take into account that we still have many people who have not received full a full vaccination schedule, and especially those people with comorbidities. An Omicron infection can become serious or very serious even, and therefore we should not relax at this point in time our measures, and we should maintain all control measures, all distancing measures in place. Another type of question regarding the situation of Mexico in particular, we have been observing an exponential growth curve in cases. Yesterday, December 11, at federal level, the record figure was hit with over 336,000 more new cases and a record of active cases with more than 70,000 active cases, 70,000 in recent days. And in Mexico, according to analyses from the health department at federal level, we will have a fourth wave, which is compared to 2021 with more cases. Finally, regarding the combination or recombination of Delta and Omicron, I would like to ask you to be cautious in interpreting this information which is circulating around, even though there may be cases of co-infection or co-detection of the two variants at the same time. At this point in time, we cannot talk about recombination. It has not been demonstrated that this phenomenon has occurred, and investigations are going on to see whether the reports are due to a contamination at lab level or some other type of contamination. We will have more information in the near future, but this is not a question right now or an issue right now. I hope I have answered your questions. Thank you very much. Thank you, Dr. Aldeguer. Now a question from Guatemala, Dalian Coyin, 1023. Guatemala has reported presence of Omicron variant. What is the scenario that foresees that is foreseen, especially given that some of the younger people don't want to be vaccinated? Dr. Ugarte, please. Yes, thank you very much. Well, during the first week of this year, we saw a very significant increase in cases of almost 185% of cases as compared to the last week and last year. As the colleagues have said before, this increase has been due to the fact that there have been many more opportunities of transmission given the holiday parties, vacations, and crowds, etc., over the holidays. And so projections indicate that Guatemala could be confronting an increase of new cases, which could be which could lead to an increase in hospitalizations, especially in non-vaccinated populations, which is what we have been seeing in other countries. So to reduce transmission and impact, the Pan American Health Organization continues to recommend accelerating vaccination in all age groups and in the susceptible populations, which will have moderate to severe cases of COVID, and to continue to implement public health measures. Yes, we are tired of wearing masks, tired of not being able to be close to our loved ones, tired of not being able to circulate freely, but these measures have protected us. And even in populations where there is a high level of vaccination, relaxing those measures has shown that the virus finds a way to transmit itself, and the significant increase in cases has been seen in Guatemala, where the positivity of cases has increased from 6% to in 6% at the end of last year to 18% at the beginning of this year, and this proportion, it continues to increase. So it is very, very important that the population that feels that they may be more resistant to the virus, like the adult and young adults, people who don't have other comorbidities, we urge them to get vaccinated for their own protection, because it would be too late when they are in the ICU. There are many cases of young people and adults who didn't want to get vaccinated because of whatever reason. They didn't want to get vaccinated, but when they become ill or their family becomes ill, they realize at that point that vaccination is the most important protection measure against COVID-19, and we should really urge young adults to become vaccinated, because controlling this pandemic will depend on them and their behavior. Thank you very much. Yes, thank you very much, Dr. Ugarte. We have two more questions from Kilian Romero from El Confidencial and Lidia Lopez from La Prensa. They want to know what is the advance of Omicron in Nicaragua, and what is happening, what is being done there to control it. Yes, thank you very much. As a follow-up, as we said in several press briefings before the holiday break, I would like to say that thanks to the continual efforts of the Public Health Laboratory in Nicaragua, Nicaragua has generated a genomic surveillance system that has allowed it to demonstrate circulation of several variants, both variants of interest and of concern, and therefore they have all capacity to carry out the characterization of the Omicron variant. In addition, I think, as I've said before in prior comments, we need to use a sub-regional approach. And in addition to Nicaragua, it is important to say that thanks to efforts in Guatemala, Belize, Honduras, El Salvador, Dominican Republic, and others, and I would like to emphasize the very proactive collaboration of the Gorkas Institute in Panama, it has been possible to maintain surveillance of variants and the timely detection of Omicron in Central America. The Gorgas Institute in Panama is the reference laboratory for the sub-region for the genomic surveillance network. So we emphasize the importance of maintaining and strengthening sustained genomic surveillance in Central America so that we can detect in time the introduction and dissemination of different variants. And we can assure you that the Pan American Health Organization will continue to work closely with all the member states to increase the diagnostic capacity, including genomic surveillance platforms in the region. Thank you very much. Well, thank you, Sylvan. We have another question from Nicaragua, from El Confidencial, question about 2022. Is Nicaragua continuing to, will Nicaragua continue to receive vaccines through COVAX? And how much is the amount, if you have any update? Yes, Dr. Barbosa, it is advancing very much. Nicaragua, a couple of months ago, was among the countries that had not even reached 10% vaccination. Today, Nicaragua has received 4.2 million vaccines through the COVAX mechanism. In addition to this, Nicaragua has also some bilateral agreements, and it has used the direct purchasing alternative through the revolving fund of PAHO, and we have already sent some vaccines through this other mechanism. So Nicaragua has 45% of its population vaccinated, and they need to continue to progress. We are in PAHO, we're working with the health ministry, searching for more advanced strategies such as door-to-door vaccination. And I think this is a good example of when you have a vaccination plan and you have vaccines available, you can advance in your plan. Thank you very much. Now, thank you, Dr. Barbosa. Another question from the Caribbean, from Deandra Hamilton.
What is the plan to get Caribbean, Latin American countries at 70% by July, as set out by WHO? That's question number one. Question number two is regarding sort of the practice where shots in arms will be as frequent as every 2 to 5 months. That's sort of a trend at the moment, and it has been described as unsustainable. What is the future of vaccination looking like in this ongoing response to COVID-19? Dr. Barbosa.
No, thank you for this question. We are concerned with the Caribbean. In many press conferences, we have called the attention about the situation in the Caribbean, because we have experience in the Americas, in the United States, but also in the Caribbean, some very important movement against the vaccine, some vaccines hesitancy that can be a barrier, very important barrier to have the people accessing and getting the vaccines that they need. As a result, we see that we have still 90 countries in the Caribbean that are below 40% of vaccination as vaccination coverage of their population. So we are working with the Ministry of Health. We are highlighting the relevance to have a very comprehensive communication strategy to invite physicians, nurses, academic institutions, community leaders, to be engaged in this vaccination effort. Let's remind people that this is not a regular disease, this is not a regular vaccine. Unfortunately, many groups are sharing every day false news, fake news about the vaccine. So it's very important to go every day to respond to them, to provide clear and transparent information so the families and the communities will be comfortable to make the right decision to get the vaccines. I think that this is very important. The economy in the Caribbean has been hitting very hard for the pandemic, and the best way to recover, to get the tourism working again in the Caribbean, the other economic activities, is to increase the vaccination coverage in the country. So we are working to get more vaccines, to have more vaccines available to these countries, and at the same time, to support the Ministry of Health to get more people willing to be vaccinated. About this trend to have a shot 2 to 5 months, this is not a recommendation yet. I think that it is important that we need to keep with the recommendations that are based in the current scientific evidence that we have. Sometimes we have one study that is saying one thing, that this will happen or not. I think that is very important to have these recommendations that are being produced by the Strategic Advisory Group of experts on immunization that make the recommendation for WHO and PAHO also. What we can say about the future of vaccination is that first, we need to complete the task that we have now. We still have many people to get fully vaccinated in the Caribbean and in Latin America. And second, we needed to monitor the behavior of the vaccines against the new variants in order to make further recommendations in the future. So I think that now we need to complete our task. We need to get more people vaccinated. We need to reach the 70%, at least 70% of people fully vaccinated in order to control the transmission, because vaccines are the best tool that we have working together with the public health measures. Thank you.
Thank you, Dr. Barbosa. The next question about treatment, pills for COVID. A question from Linda Straker from Now Grenada. She asks, recently the FDA approved a pill for the treatment of COVID-19, and she refers to the Pfizer's Paxlovid. Her question is, can PAHO say whether or not it is working towards having countries in the region administer this pill for COVID-19? And if there are any pharmaceutical manufacturers that PAHO is working with in the region or supporting that are producing a generic version of it? Dr. Aldigueri?
Thank you for this question. I would divide my answer into two parts. First, what we are doing in terms of new access to new therapeutics, including antivirals, and after, what is the regional landscape for the production of generic medications. So PAHO periodically evaluates the evidence regarding potential therapeutics for the prophylaxis and management of COVID-19 patients. At this moment, those therapeutics include monoclonal antibodies, such as Regencov, Sotrovimab, and antivirals, such as Remdesivir, and a combination of Nirmatrelvir/Ritonavir, called Paxlovid, or Molnupiravir, for the management of high-risk patients with non-severe disease. So PAHO is working to provide access to those therapeutics that are currently or that would potentially be recommended. Antivirals will be manufactured through voluntary licensing agreements and made available to some countries based on agreements with the medicine patent pool. Countries in the regions may also produce the product with an agreement with the medicines patent pool. These products can be considered generic products and may be of importance in ambulatory care for vulnerable groups. However, the list of countries would be very limited for the Americas. So in this context, we urge manufacturers to make available the know-how required for the production of antivirals to all countries that need them in time of pandemic. In addition, the PAHO Strategic Fund continues and will continue to negotiate with the manufacturers to make available antivirals of proven efficacy available to these countries that need them. I hope I have answered the question from the colleague in Grenada. Thank you.
Thank you, Dr. Aldigueri. We are sort of coming towards the end of our session, but two more questions we would like to take. One is from Nora Gomez Torres from the Miami Herald. She asks, there has been some confusion regarding the status of the Cuban vaccines. Can you clarify if Cuban officials have officially submitted a pre-certification request for their locally produced vaccines, and in which stage is PAHO's evaluations of the Cuban vaccine, or the WHO's evaluation, I would say. Dr. Barbosa, perhaps you have a comment on this?
Yes, very briefly. First, let's make a clarification. PAHO does not make any authorization or pre-authorization of vaccines. So the the WHO, the World Health Organization, is responsible to make the pre-qualification of medicines and vaccines. And during this public health emergency, WHO pre-qualification team, after assessing the vaccines, they are releasing emergency use listing authorization. So it's WHO who is responsible, not the PAHO. Second, it's important to recognize the very important achievement made by Cuban scientists and the vaccine producers, because they developed the first vaccine totally developed and produced in Latin America. So it's important to have this vaccine in this list of vaccines that received the emergency use listing from WHO. PAHO facilitated the contact between the vaccine producers in Cuba and WHO Geneva. They have had 2 meetings so far. They presented some reports from the vaccine. Our colleagues from Geneva clarified the process to them, and I understand that now the Cuban vaccine producers are preparing the dossier that they need to send to Geneva to be reviewed, and after that, Geneva will make a decision. So this is related to WHO. But again, the use of a vaccine in one country is a decision that needs to be made by each national health regulatory authority. So I am telling you how is the process with WHO, but it's not related to a national decision that some countries have made to use this or other vaccines. Thank you.
Thank you, Dr. Barbosa. We are coming to the end of our session for today. I apologize to the journalists that are sending a lot of questions. We unfortunately cannot get to all of them, but we will try to sort of combine them and see that we get it. The last question for today we received from several media, including the Associated Press, Gisela Solomon, and somewhat related from the New York Times, Daniel Politi, the impact of the new variant and the prolonged pandemic and the rising cases. More details on the impact on health services, particularly healthcare workers. Dr. Etienne, this final question for you. Thank you.
Thank you for this question. And really, it is a great preoccupation for us, the possible impact on the health services. So in the first week of 2022, we have seen the highest number of weekly cases since the start of the pandemic. And cases rose by some 77% over the previous week, and deaths jumped by 31%. So there is no question that Omicron is having an impact. At least 17 countries and territories have reported increases greater than 50% in hospital admissions, and including in ICUs. And that is as compared to the previous week. The largest relative increases were in the Caribbean subregion and in Central America. And this is particularly important in the Caribbean, where we see hospital capacity prior to COVID-19 being limited. A number of Caribbean countries, including Antigua and Barbuda, Aruba, Bahamas, Bermuda, Cuba, Curacao, French Guiana, Jamaica, St. Martin, and Suriname, experienced 100% or more relative increases in COVID-19 hospitalization as compared to the previous week. We are also concerned by the fact that several of the countries and territories experiencing these large increases in weekly hospitalization also have a low coverage of eligible population having received a complete vaccine schedule. The impact of these pressures has also been difficult for our health workers who staff the primary health care centers, clinics, and hospitals. Let's face it, our health workers have worked tirelessly for 2 years caring for patients. And many of them have gotten sick themselves. And alas, too many have died. They have suffered physical exhaustion. But not only this, we have a study that shows that as many as 22% of health workers in various countries have suffered from depressive episodes. So there is no question that health workers need our support. As we continue to battle the COVID-19 pandemic in 2022, we need to remember that healthcare workers are protecting us, and we also must help to protect them. All of us together, we must work to reduce the transmission of the Omicron variant and certainly all variants of SARS-CoV-2. And we need to do this by ensuring high vaccination coverages. We need to be our neighbors' keepers. Please encourage your friends, your neighbors to get vaccinated as soon as possible. And at the same time, we must adhere to the public health measures that have been so well described, but have proven to be efficacious and effective in reducing transmission of the virus. Let us remember that it is together, caring for each other, that we will stop COVID-19. Thank you very much for listening to us this week, and we shall see you next week. Thank you.
Thank you very much, Dr. Etienne, for those important final words. Colegas, llegamos ahora al final de nuestra sesión de hoy.
Colleagues, we have reached the end of our session today. We are looking forward to any comments that you can send to mediateam@paho.org. I would like to thank the director and also the experts for today's brief, and we are planning to host a similar session next Wednesday. The best of you for the rest of the week, and good health to all. Thank you very much.